One.
You can go to slideshow at the top on the right. Okay, so this is a county health assessment of Washington County. And I'm going to start by giving a synopsis of Washington County and the general demographics. So next slide. So Washington County is the third largest total population in Arkansas, and it has about 220,000 people. 70% of the population is white non-Hispanic, 4% are Black non-Hispanic, and 18% are Hispanic or Latino origin. 24% are under the age of 18, and about half the population are women. And I wanted to point out the demographics because Washington County has fairly decent indicators of health, but these indicators affect these racial and ethnic groups disproportionately. Next slide. So a few of the health indicators that I found for Washington County is that the life expectancy is 78 years, which is similar to the US population, which is 78.5. And it actually ranks number 3 amongst Arkansas counties. The infant mortality rate is also similar to the US trend at 6.7 and 6. And it ranks 37 amongst Arkansas counties. I denoted infant mortality with an asterisk because there's actually a disproportionate effect of for Asian population. The Asian population actually has infant mortality of 23 per 1,000 live births compared to white and Hispanic groups, which is they experience 5 to 6 deaths per 1,000 live births. The teen birth rate is ranked at 6 for Washington County amongst Arkansas counties. Youth smokers is ranked number 10 at 3.7% for Washington County. Adult smoking is ranked 46, so that's a pretty good health indicator. Deaths from injury is ranked at number 2. And although it's fairly lower than the average US population deaths from injury and percentage, it affects Black people at a disproportionate rate in Washington County. And for low birth weight, again, even though it's at 8%, which parallels the US population trend, it also affects the Black population at a disproportionate rate. Next slide, please. So now let's talk about some of the major health risk factors and outcomes that contribute to those health indicators. Next. Food insecurity affects 15% of the county, and Washington County is ranked number 10 in food insecurity. Physical inactivity, they're ranked at number 3 and it affects 26% of the county. Obesity also affects 33% of the county and it's ranked at number 11. Low health literacy affects 31% of the county and it's ranked at 5, and 22% of the children living in Washington County fall below the federal poverty line. I also included STI rates because STI rates can kind of give insight to health indication about health education, sexual education, access to testing and treatment, and the usage of those accesses. You can click the next slide. Okay, so we can see that Washington County is in the red circle, and it follows the same trend as Arkansas rates and the United States in general, steadily increasing since 2007. But it's fairly higher than the Arkansas trend and total US. So Washington County is actually getting worse in STI rates. The next slide. So now that we're talking about access to insurance and healthcare. The uninsured rates also follow the nationwide trend and the statewide trend, in that it decreased around the year. The uninsured rate decreased in 2013, and it kind of increased in 2018. And the uninsured rates in Washington County are actually a bit higher than the average Arkansas and United States rate. So Washington County is getting better for uninsured rates. Next slide, please. Primary care physicians have been, the ratio of physicians to population has been pretty steady since 2010 for Washington County. And this also applies to dentists and mental care providers. Next slide, please. So Washington County actually has 10 medical centers and hospitals, 3 rehab medical clinics, and 9 of these facilities list Medicare and Medicaid as acceptable insurance. They also have the Washington County Health Unit, which provides many services through the Arkansas Department of Health, such as immunizations, women, infant, and children nutrition program, testing, and surveillance programs. And they also distribute county health statistics every so often. I believe this screenshot is from the year 2017, and they released their budgetary items and their visitation to their local health units to get treatment and usage of their services. So next slide, please. So in summary, Washington County is actually ranked 2nd healthiest county in Arkansas. It has the top percentile for length and quality of life based on access to healthcare and some of those health indicators like life expectancy. They also rank top percentile for other health factors, but there is still room for improvement, such as addressing low health literacy because they ranked number 5, and improving some of the disparities among the health indicators. So now that we know some of the health indicators and some of the room for improvement, we can talk about new program suggestion for Washington County.
So based on the Washington County Health and Healthcare Assessment, the major health risk factors include food insecurity, lack of physical activity, and low health literacy. Next slide. So for food insecurity is the state of being, food insecurity is the state of being without reliable access to sufficient quantity of affordable nutritious food. So as a way to improve on food security, I propose that community food projects should be, added to the Washington Health County. And food security is strongest when food is produced and distributed locally. So locally grown food is fresher and so much nutritious, and it builds the local economy as money circulates to farmers and businesses in the area. And it also helps build relationships among people and making communities stronger and healthier and healthier places to live. Also, making healthy food available at fair prices, like organizing a farmers market where this reduces the cost of transportation to people and the need for a middle merchant, so farmers earn more and consumers pay less for money. So these two can help reduce the food insecurity in Washington County. So next slide. So physical inactivity is one of the major health risks in the Washington County. So physical inactivity predisposes to several chronic diseases. Individuals nowadays find it difficult to exercise because of lack of time, as everyone is busy or have a job to do. So to improve on this, designing activity-friendly routes to everyday destination is a design that improves the communities by connecting routes such as sidewalks, trails, bicycle lanes, and public transit to destinations such as grocery store, social schools, work sites, libraries, parks, or healthcare facilities. Also, establishing community gardens could also serve as a way to improve on physical activity and also food insecurity in Washington County. Installation of community playgrounds or upgrading on an already parks and playgrounds in Washington County could also solve the problem of physical inactivity. Next slide. So health literacy. For health literacy, Washington County ranks among the top 10 counties in Arkansas with low health literacy. And this stands for one of the most important health risk factors which affects the overall health care of the community. The health literacy is defined by the CDC as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Next slide. So the CDC also proposed the National Action Plan to improve health literacy in 2010 by the United States. And the National Action Plan to improve health literacy was released in May 2010 by United States. The Department of Health and Human Services seeks to engage organizations, professionals, and policymakers in communities and individuals and families in a linked multi-sector effort to improve health literacy. And the vision included to provide everyone access to accurate, actionable health information, deliver person-centered health information and services, and support lifelong learning skills to promote health. The CDC also set up 7-goal plan to improve health literacy. Next slide. So the first goal was to develop and disseminate health and safety information that is accurate, accessible, and actionable. The second goal was to promote changes in the healthcare delivery system that improves information, communication, informed decision-making, and access to health services. The third goal was to incorporate accurate and standard-based health and developmental appropriate health and science information and curricula into the childcare and education through the universal level. The fourth goal was to support and expand local efforts to provide adult education, English language instructions, and cultural, linguistically appropriate health information services in the community. The fifth goal was to build partnership, develop guidance, and change policies. The sixth goal was to increase basic research and the implementation and evaluations of practices and intervention to improve health literacy. And the seventh goal was to increase the dissemination of use and evidence-based health literacy practices and intervention. So currently, Arkansas is part of the states that have adopted the 7-goal plan for literacy, and they are acting upon it and using it to improve health literacy in Arkansas. So I propose for this plan to also, for the Washington County to add this in their health services to help to improve on health literacy in the county. All right, so we'll move to strategies.
And for our stakeholder engagement plan, we discussed a shared use agreement among public fitness centers that would allow high schools to open up a lot of their athletic facilities to the general public in exchange for the city governments devoting money back into the athletic departments in order to have a mutualistic agreement. And so through this policy, the Washington County cities and local high schools would agree on a proposed 24/7 public access of outdoor tracks and fields at high schools as long as they're not being used by the school. They agree on a 3-hour window in the mornings and afternoons that includes indoor courts, weight rooms, any athletic facilities that the high school is not currently using. And upon agreement, the cities will be responsible for the maintenance and improvement of the public high school's athletic facilities. And for the public side, the city would devote money to create nutrition and guided fitness classes at these facilities. And what they're trying to get is that a lot of Washington County cities have public fitness areas, but they're not accessible to a lot of the residents. And so having high schools that are in the neighborhood that have these nice athletic facilities that most of the time go unused by the majority of the citizens, this would allow the citizens to have more accessibility to fitness centers. And the stakeholders in our engagement plan would be the city administrations of the respective cities within Washington County, the Arkansas Department of Health, as well as the Arkansas Department of Education. This includes the school districts and individual school administrations. We thought to add Washington County Regional Medical Centers, administration, nutritional staff, public health staff, and marketing team who could help foster, especially the public fitness classes and nutrition classes. And of course, the main stakeholders would be the citizens of Washington County, because this is who it would benefit. The steps to implementing our plan would to develop a consortium of Washington County City Administration to meet with the Department of Health and Department of Education to discuss previous cities' plans for the shared use agreement. We would then develop common public goals for the counties that and determine what they like to achieve through the program. We'll then include the Washington County Regional Medical Center to discuss partnering to offer nutrition classes, then develop a common proposal that each city would then present to the school districts. And then once approved, we would move into the implementation stage. And the implementation stage would be once the schools agree to the shared use agreement, the marketing teams would implement the program. You could use ads to get the knowledge out to the citizens to expand public knowledge about the program and the classes offered. And then over time, we would develop feedback for the cities and schools to adjust hours and the classes based on public need, as well as develop a schedule for assessment based on public use of the facilities and possible expansion opportunities. Some possible issues that we could see arising is that the program is developed or designed to benefit all citizens, but is only implemented within public school facilities. And this raises the question, what about the private schools? Because there's a lot of very nice private schools in Washington County. And what we thought is that if a private school would like to allow access and join the program, this could be allowed, but the city could not use public funds to improve the private school athletic facilities. We also thought, what if these facilities go unused? And I believe that a 5-year assessment of use could be beneficial to determine if the program is successful and if cities need to expand or shrink the program, because I'd hate to see public dollars go to these programs and not be used. But on the flip side, since we're agreeing that the city would be responsible for the maintenance and upkeep of these athletic facilities, the funding for improvements of these facilities would be independent of public use, public uses of the facilities. And that's it. That is our project, and here are some references. And I believe that's it.